Hello and welcome. Today we bring to you Dr. Aaron Harthan. Welcome, Dr. Harthan.
Thank you. I'm glad to be here.
Yes, Dr. Harthan is the primary author on the latest manuscript coming out today from virus COVID-19 registry. They looked at the combination therapy of immunoglobulins and steroids in most vulnerable population, the pediatric population, especially MISC, multi-system inflammatory syndrome patients. So Dr. Harthan, many congratulations for your publication. It is already out online since June, and today it is getting published. So thank you so much for being here with us. Tell to our viewers what is the study about and what are your main results and what's the summary of your results?
Thank you. Thank you. I appreciate it. Congratulations to you as well for being a co-author, and I appreciate all your help on this. I'm Aaron Harthan. I'm one of the pediatric pharmacists here at the Children's Hospital of Illinois in Peoria, Illinois. And the paper that we were working on was looking at or assessing outcomes in children who have multi-inflammatory syndrome in children with different treatment modalities, specifically intravenous immunoglobulins, otherwise known as IVIG, corticosteroids such as methylprednisolone would be the mainstay, and trying to assess how patients responded, how children responded to that. One of the major factors that we were looking at that was kind of different from some of the other registry studies that have been published so far. There was a French study, a study out of the United Kingdom or out of London, and then one study from the another registry here in the United States. And they looked at different kind of what I would say surrogate markers for maybe some endpoints. Fever defervescence would be one thing, and treatment failures, time on event, coming off a ventilator, time on vasoactive substances, medications required to facilitate blood control, blood pressure control, et cetera. But we really wanted to focus on the length of stay in these patients. We understand that length of stay is an extremely difficult marker to kind of adequately assess because there's so many different factors that can go into that and can confound or impact those values. But we thought using the registry data that would give us great data to kind of get a robust patient population and assess these. So we looked at multiple medications, as was mentioned. We looked at combination therapy with IVIG and corticosteroids compared to IVIG alone, which is what the other registry studies had kind of assessed. We also compared it to corticosteroids alone, which only the best available treatment study had kind of assessed. And then we also had the data to compare to no treatment, which is, again, kind of one of the things that is beneficial for us in that no other study that I'm aware of had actually assessed that. The results that we found, the primary results, was that the ICU length of stay was decreased by 1.6 days, or you can round to 2 or 1 depending on when patients were admitted. Obviously, there's different factors that go into that, but from a strictly data perspective, 1.6 day decrease in length of stay in the ICU with IVIG and corticosteroids when compared to no treatment alone. IVIG and corticosteroids were not associated with a statistically significant decrease in length of stay and ICU length of stay. And unfortunately, we weren't able to find any differences in hospital length of stay when we adjusted for multiple things that we considered what appeared to be confounders based on those logistic regressions to try and identify that. So unfortunately, it did not transfer over to the hospital length of stay, which could be a result of multiple factors, but we were able to find, again, and kind of in line with the other data that's out there, that there seems to be improvement in children who are getting both IVIG and corticosteroids in overall outcomes.
Fantastic. Well, running a study, a landmark study like this for the first of its kind from a large registry, I'm sure it requires a lot of discipline and there are too many challenges. So tell to our viewers, especially the young investigators, scientists, the RN, PhD, PharmD and MDs, what are the skills that you had with you and your mentor at your institution, which helped you in doing some of this analysis and some of this study? And then second question is how you dealt with all challenges. What are challenges you came across in terms of data and other things?
Yeah. So one of the starting off with, what did we kind of look at? What things could we, if someone who's starting off with a registry, it is very difficult to kind of know where to start. Even in thinking about this, where to even start when you have all this data that's available. I mean, there were rows upon rows upon rows of data. And if you look at our study, you can see from the supplementary material, from the results, that we have tons of data, which is great to have, but again, it can be kind of overwhelming. So having a mentor or people to kind of help you, guide you through that process. What are the key factors that you want to start off with? What are the things to kind of hone in on in that process versus just having, a broad scope is always helpful. Obviously, mentors are tremendously impactful in helping you develop this. I had Dr. Tripathi with me, who helped, from the concept, study design concept, through data collection, through data manipulation, right? Because there's different, especially in a study, in a registry like this, you have variations in, just things like how people are recording temperature, right? In some places, people are recording it as Fahrenheit. Some people are recording it as Celsius. And so having to go through and address those, update those. One of the other challenges that we had, for example, was, people wouldn't necessarily document that they got intravenous immune globulins, IVIG, but then when you looked at the comments, they would write in that the patient received IVIG. So again, going through and kind of cleaning that data up so it's data that you can work with, which is, it can be time consuming, but again, you may not even recognize that you need to go through and clean that data up without the help of mentors and people to help guide you through that process. As for your second aspect of that question, I think maybe I kind of addressed it, but I think mentorship, and then there are multiple challenges. Some of the other things like limitations with a study like this are, data entry. If people, like I already kind of mentioned with the IVIG, if people are entering data and maybe they're not as familiar with the data, if you have, people whose role is more data entry than, say, healthcare professionals, physicians, pharmacists, nurses, etc., they may enter data that's not necessarily as accurate as you would like, or, I mean, we're all human, right? And so I can imagine accidentally typing something in incorrectly. And so then you have to kind of work with that data and improve it. I don't know if improves it, fix that data, manipulate that data to make it appropriate and adequate.
Oh, absolutely. I think those definitely at the site, the registry organizers, that we should eliminate all free text search part of it. That makes life very, very easy looking in hindsight, and as well as dealing with the large set of data with missingness, and some of those things are real one. I'm glad that you mentioned mentoring and mentorship, which is a big deal in a healthcare field. I don't know if mentoring is very important anyways, but I don't know if any disciplines within medicine can survive without proper mentoring. We get mentored from pharmacy school, nursing school, medical school, or graduate school and PhD throughout our life, once, and then we turn to a mentor at some point of our time. Like we'll be in a mix of being mentored and mentoring few people. So I'm so glad that you picked up on that, and many of our investigators have been benefited. The registry was able to create this new crop of investigators in last 2 years, and then then mentors took a role, and so on and so forth. You joined registry kind of midway in a point, like we started in March 2020. Dr. Tripathi has been involved, I think, one of the first few sites to enroll patients right in March and April 2020. What has been your experience being participating in the registry from an angle that what advice you would give it to junior or young investigators in any specialty within healthcare?
Yeah, so I've been lucky that I've been working with other aspects, not necessarily the registry, but the SCCM Stop Virus Collaborative. And so my experience has been, in my experience throughout my career is SCCM and mentors and the collaborative, the virus registry, everyone there has been very great to work with, very collaborative, which is always excellent to see, especially from a pharmacist perspective. I mean, my mother was a pharmacist, and so I grew up with stories of, various healthcare fields where there was, pharmacists maybe looked down upon, or you weren't as up to par as, say, the physician. But that has not been my experience. And it's always been great to get that and have that collaborative nature. I think we all help each other develop better research, develop better questions, improve patient care through that. So I've always appreciated the Virus Collaborative, the Virus Registry for being so open and welcoming, helpful new investigators. I'm sure if they wanted to come in, you get the opportunity to have kind of experienced people, experienced practitioners, kind of take your idea and refine it. So if, sometimes I've struggled in research coming up with an idea that maybe meets all the, to use an acronym, the PCOT, is it timely? What are your objectives? All those different things in the PICOT data or study idea, and making sure that you fit all those models. And so the Virus Registry, having those mentors, having those experienced practitioners help you refine that question, and then address some of the issues that you may not even anticipate coming up, has been excellent. So I appreciate that, and would strongly encourage anybody who is looking to develop research practice, improve their research skills, to join the Virus Collaborative, to join the Virus Registry, and get that opportunity to work with people across the nation, across the world, which is extremely beneficial.
Absolutely. Last question. So what is next for you and Dr. Tripathi? Now you're publishing this landmark study. What you're working on what you like to work on?
Yeah, I mean, I am all over the place. I'll be honest. I have a lot of different irons in the fire. Maybe not so great for my grant opportunities, but it keeps me interested and keeps me, again, honing my skills. One of the things, maybe if we were looking purely from a virus registry, what I would like to see is if we could get better data, improve our data on different dosing, especially from the MISC perspective. Most places, most data is reporting IVIG is giving 2 grams per kilo. Methylprednisolone is usually like 0.8 to 1 to 2, or in the registry studies kind of across the board, upwards to 30 milligrams per kilo daily. So what is that dose? Most of the dosing has been 1 to 2. The American College of Rheumatology recommends 1 to 2. But again, if you look at those registry studies, upwards of 20% of the patients in that study got 30 milligrams per kilo per day. So identifying the best doses, identifying the best medications, is methylprednisolone better than dexamethasone or vice versa? So those are all clinical queries that I think we need to work on, refine, hone. And then, like I said, one of the next projects I'm working on is looking at AUC monitoring with vancomycin and nephrotoxicity rates in our pediatric patients. So just trying to improve patient care where I can.
Well, you're keeping yourself busy, but we really, really thank you for leading these efforts along with Dr. Tripathi, publishing a major study as well, and coming online today to talk to us. And those who are watching, please like, subscribe, write in comment section what you like from Dr. Harthan's talk today. And if you want to collaborate, let us know. We can put his LinkedIn information in the video, so you can reach out to him directly. Once again, thank you so much, Dr. Harthan, for being with us today.
Thank you for having me.
Absolutely.